Today, the COVID game is far from over. Hello again, it's Martin North from Digital Finance Analytics, our latest post covering finance and property news with a distinctively Australian flavour. According to the IMF, the recovery is not assured until the pandemic is beaten back globally. And so the COVID game is far from over. In its latest global outlook, the International Monetary Fund maintained its outlook for the biggest rebound in global economic growth in 4 decades, while changing underlying regional forecasts, with unequal access to vaccine further widening the recovery gap between advanced and developing economies. World output is still expected to grow at 6% in 2021, following last year's 3.2% drop, but it reduced the forecast for emerging market expansion to 6.3% compared to 6.7% projected previously in April, and raised the estimate for advanced economies by 0.5 percentage points to 5.6%. In fact, the UK got the biggest bump among the major economies, with the IMF now forecasting a growth rate there of 7% in 2021. That's a touch lower than the Bank of England estimates. For 2022, the IMF now sees global growth at 4.9%, up from 4.4%. We warned of a dangerous divergence, and we are seeing that getting worse, the IMF chief economist said in an interview on Bloomberg television. We are not out of the woods with respect to the pandemic. Vaccine access has emerged as the principal fault line along which the global recovery splits into 2 blocks: those that can look forward to further normalisation of activity later this year, almost all advanced economies, and those that still face resurgent infections and rising COVID deaths, the IMF said. The recovery, however, is not assured even in countries where infections are currently very low, so long as the virus circulates elsewhere. To address the widening gap, the Washington-based fund urged advanced economies, which have inoculated about 40% of their populations on average, to share their vaccine supplies with poorer nations. Multilateral action is needed to ensure rapid, worldwide access to vaccines, diagnostics, and therapeutics, they said. This would save countless lives, prevent new variants from emerging, and add trillions of dollars to global economic growth. In May, the fund proposed a $50 billion plan to end the pandemic, in which 40% of people in every country would be vaccinated by the end of the year. The World Health Organization, the World Bank, and the World Trade Organization all endorsed the proposal. And among other findings, they showed that emerging Asia saw the biggest downgrade among regions, with the IMF trimming the growth projections for this year by 1.1 percentage points to 7.5%. There was a 3 percentage point cut in the annual growth rate for India, hurt by a severe second COVID-19 wave from March to May. And despite this growth, domestic product there is set to expand at 9.5% in 2021. The forecast for sub-Saharan Africa is unchanged relative to April, with worsening pandemic developments expected to weigh on the region's recovery, and a 0.9 percentage point increase in South Africa's forecast offset downward revisions in other countries. The fund raised its GDP expectation outlooks for the US, the Euro area, Latin America, and the Middle East and Central Asia. And inflation is expected to return to its pre-pandemic ranges in most countries in 2022, once these disturbances work their way through prices, the fund said. Elevated inflation is also expected in some emerging market and developing economies, related in part to high food prices. And they said risks are tilted to the downside, with uncertainty surrounding the global baseline remaining high. Delays in administering vaccines would allow new variants to spread, with possibly higher risks of breakthrough infections among vaccinated populations. Concerted, well-directed policies can make the difference between a future of durable recoveries for all economies or one with widening fault lines, as many struggle with a health crisis, while a handful see conditions normalise, albeit with the constant threat of renewed flare-ups. the IMF said. And elsewhere, Bloomberg reported that just a few weeks ago, much of the world seemed poised to leave COVID behind. US President Joe Biden declared the US close to independence from the virus. Britain's hit the dance floor to celebrate Freedom Day, and Singapore's legendary strict government signalled it will begin to loosen its zero cases approach and make life and travel more manageable. But if those places were ready to be done with COVID, COVID wasn't done with them. The sputtering US vaccine campaign has run headlong into the highly contagious Delta variant. The UK's reopening has coincided with a new surge of cases and fears of long COVID in younger people. In Africa, deaths have spiked as vaccine supplies remain meagre, and in Japan, rising infections have forced the already delayed Summer Olympics to be played in empty stadiums and arenas. Around the globe, people and governments are finding out that COVID won't be thrashed into extinction, but is more likely to enter a long, endemic tail. With that will come delayed recoveries in the places that have had the least access to vaccines, and vaccine and resource-rich countries will still face their own health and economic aftershocks, as the US and UK are discovering. The virus is going to do what it wants to do, said Michael Osterholm, Director of the Centre for Infectious Disease Research and Policy at the University of Minnesota, and not what we want it to do. Vaccines have made a difference in the places that have deployed them widely. In recent weeks, US cases have risen dramatically, but there hasn't been an equivalent surge in deaths, and the number of new infections has dropped over the last few days. The shots are literally lifesavers. At its current pace of vaccination, 75% of the EU population will be inoculated within 2 months, a level that may be sufficient to push back the virus. China and the UK are running at a similar pace. But after racing ahead, the now stalled US vaccination campaign will take 8 or 9 months to reach 75% coverage because of entrenched pockets of vaccine resistance in parts of the country. Other places are in much more dire straits. Indonesia, with a raging outbreak, is 1.5 years away. India will need another year at its current rate. In Africa, countries like Egypt, Nigeria, and South Africa are at least a year away or far longer. A handful of places are only a few months away from completing vaccinations for 75% of their populations, but many others are lagging. Many lower-income countries are reliant on COVAX, the program set up last year to equitably distribute vaccines to every corner of the planet. But the initiative has delivered just 140 million doses of the 1.8 billion it aims to ship by early 2022, hurt by delays in supplies from India. The world's divided between countries which do have vaccinations and countries which do not have vaccinations, said Klaus Storr, a former World Health Organization official who played a key role in the response to SARS in 2003. In the have-not regions, the virus is going to end the pandemic, not the vaccine, unfortunately. The pandemic struck $15 trillion off global output in the worst peacetime recession since the Great Depression, and the vaccination disparity is creating an economic wedge as rich countries recover more quickly than less wealthy ones. It is creating a two-speed recovery process. World Bank President David Malpass told reporters on July the 15th. The burden is likely to be greatest in the world's poorest places. Lawrence Summers, the former US Treasury Secretary, told reporters on a call earlier this month. COVID will be remembered as one of the grave economic events of this century for the US, but potentially the gravest event for parts of the developing world, said Summers. There's a danger this year's V-shaped rebound mutates into a W shape, where growth lurches lower again before recovering, said Warwick McKibben, a professor of economics at the Australian National University. Governments are running the biggest deficits since the Second World War and have provided more liquidity in the past year alone than the previous decade combined, limiting their options to propagate economies. Further, McKibben said, the highly contagious Delta variant has added to the uncertainty. According to recent analysis, the fast-spreading strain could widen the split in how fast more and less vaccinated places bounce back. In Africa, only 1.5% of the population is fully vaccinated, according to the World Health Organization. The continent has been hit by a wave of infections and rising deaths, while health systems are in dire need of oxygen and intensive care beds. The disparity is stark in the Southeast Asian nation of Indonesia, one of the pandemic's latest hotspots. There, cases surpassed 50,000 a day, similar to the UK's recent peak. But the lower middle income country has only given full vaccinations to 6.9% of its population compared to 56% in the UK. That lack of vaccination has contributed to the country's 1,500 a day death toll. In the UK, that number is less than 100. Indonesia and UK see similar trends in new cases but divergent deaths. That inequality is repeated around the globe. The wealthiest 25 countries and regions around the globe have administered 18% of the total doses given, despite having only 9% of the population. Those conditions are a toxic cocktail for disaster, said Joanna Liu, Professor of Global Health at Montreal's McGill University and former international president of Doctors Without Borders. It's like climate change, she said, from Tunisia, where she's helping in the COVID response. We see it coming. We don't know how we're going to stop it. It needs a huge collective effort, meaning solidarity, sharing, and equitable distribution of vaccine and goods. Inequitable distribution of vaccines also could enable the virus to keep circulating and spawn more worrisome variants that could escape the immune protection from vaccines and pose a threat to everyone, including rich countries. That would be especially alarming if those strains advanced at the start of winter, when conditions are ripe for respiratory viruses. We are letting this virus run wild in most of the world, said Saad Omar, director of the Yale Institute for Global Health. Although the worst is likely over for the US and its European peers, those fortunate countries can't let their guard down. The UK dropped virtually all the remaining restrictions on July the 19th, but scientists worry about rising numbers of people suffering from persistent fatigue, shortness of breath, cognitive issues, and a range of other troubling problems. About 1 million people in the UK already reportedly have those long COVID symptoms. The country prioritised older age groups in its vaccine drive, meaning a lower percentage of young Britons have received their shots. In the US, vaccinations slowed to a crawl just as the Delta variant began circulating. While the rate of deaths hasn't yet followed the spike in cases, hospitals in less vaccinated American regions are filling up with COVID patients again. This virus has no incentive to let up, Rochelle Walensky, director of the US Centre for Disease Control and Prevention, said in a July 22nd briefing. A handful of citizen states have considered or are starting to re-implement public health measures like masking, but most have not. What we're seeing is irrational exuberance, said Bruce Alwood, a senior advisor to the World Health Organization. The view instead should be cautious optimism, he said. We're in the heat of the battle with an enemy that we're only starting to understand and come to grips with, he said. Hotspots could emerge in parts of the US and other places with patchy coverage, but there are worries that even in well-vaccinated areas, risks will remain. Anthony Fauci, the US government's top infectious disease doctor, said on Sunday that booster shots may be necessary to protect some people, such as the elderly or those with compromised immune systems. And outside the US and Europe, it may be a year or more before vaccine production ramps up to the point that the pandemic can start to be under control, said William Moss, Executive Director of the International Vaccine Access Centre at Johns Hopkins Bloomberg School of Public Health. Around the globe, there are many places that have taken strict measures to stop infections from arriving, but haven't used the time to vaccinate. In Australia, less than a third of its population have received a first dose, and the country has imposed new lockdowns on half its people after the Delta variant leaked into the country. Even after catching up on vaccines, Other nations such as Singapore have returned to lockdown-like conditions in the face of new clusters and growing uncertainty. China, meanwhile, seems no more able to move past the pandemic than any other country. The country successfully stamped out the virus a year ago and is now just a couple of months away from fully vaccinating 3/4 of its vast population, which is an astonishing feat. Life has been normal for the majority of its citizens through the past year, and the economy has boomed, yet the border is firmly sealed to outsiders, and citizens cannot return without serving a long quarantine. Despite widespread vaccination, continues to deploy aggressive measures wherever virus flare-ups occur, from locking down housing compounds to mandatory mass testing of entire city populations. The efficacy of its vaccines have also been questioned after other places that have relied on them, including Mongolia and the United Arab Emirates, have seen new infections surge. We're still early in this fight, Moss said. We are going to continue to see widespread transmission in most countries in the world. And after more than 4 million deaths and around 200 million cases, the world is weary. But the bottom line is nations will need to figure out how to live alongside the virus. Many scientists expect the disease to become endemic, circulating for years to come, but likely posing less of a threat over time as people develop some immunity to it through natural infection or vaccines. It's clear that we also have to balance the social impact of lockdowns with the health impact, the mental health impact and the economic impact, said Sally Davies, England's former chief medical officer. There's a lot for us to learn, and we don't have the answers to quite a bit of it yet. In Japan, the world's third largest economy, another COVID emergency in Tokyo, and the decision to ban spectators from the main athletics events has overshadowed the country's hosting of the Olympic Games, smashing hopes for an economic springboard. Unlike a track sprinter, easing up too soon before the finish line, leaders and people around the world have been too quick to want to declare an end or the beginning of the end to the pandemic. The 1918 influenza pandemic that killed 50 million people before it burned out had 3 major waves running from March of that year to the summer of 1919, according to the CDC. Meanwhile, vaccination campaigns against other major viral diseases have taken many years to reach the far corners of the world. More than 60 years after the first polio vaccines, rare cases of polio still occur in some countries. Wanting the pandemic to be over has really caused many people to just not face the facts, said Osterholm, the University of Minnesota infectious disease expert. I don't think the final script has been written for this pandemic at all. I'm Martin North from Digital Finance Analytics. Many thanks for watching, and I'll see you again next time.